With measles cases recently reported in Texas and New Mexico, Colorado health officials have been urging vigilance. Now measles has been reported in Colorado. While this does not yet constitute an outbreak, it is a timely reminder of critical importance of vaccination and community protection. Dr. Lindsey Fish joins us today, and as she does every Thursday, to provide update and guidance. Okay, so now we have 3 confirmed cases of measles in Colorado: Pueblo, Denver, and Archuleta County. What should people know about this update?
Well, measles is here. We thought it was coming, and it has arrived. What is most important to know is that you can protect yourself from getting measles by getting vaccinated. 2 vaccines, 97% protection from an infection, so very effective. The 2 cases in Pueblo and Denver were a result of travel, meaning they had traveled out of the country, been exposed to measles in an area of outbreak there, and then returned here. The Archuleta case, unfortunately, does appear to be community transmission, as that person has not traveled.
Interesting. So can you remind us why we're seeing a resurgence of measles, even though it was eliminated for the most part 20 years ago? And, just how quickly this can spread. We were talking about on the break that this can move like wildfire through communities.
Right. So really it was eliminated because of great vaccination. And we need 95% of people to be vaccinated to prevent the spread. So what's happened over the last 25 years since we eliminated measles is people have not gotten vaccinated. That's a combination of concerns about the safety of vaccines, misinformation about vaccines, and difficulty obtaining it. Measles travels into our country all the time from other countries where there isn't vaccinations. But once it's here, what prevents it from spreading is that we are all vaccinated. Unvaccinated people spread this very quickly. One person can infect 9 unvaccinated people. So you can imagine 1 person, 9 person, 81 people, and suddenly it has just spread like wildfire.
Interesting. So how serious is the measles? I think because it was eliminated for so long, it's something that a lot of us don't know what it actually is and who's the most vulnerable.
Yeah, so measles is a virus, and many people experience common viral symptoms: fever, cough, runny nose, itchy, watery red eyes, and a rash. But the problem is 1 in 5 unvaccinated people will end up hospitalized. So that's a really high rate of hospitalization from a virus. You're hospitalized from pneumonia predominantly, so lung infections. We see brain infections, permanent deafness, and unfortunately, we've seen in Texas some deaths.
Yeah, it's been very unfortunate. Can you talk about the safety and effectiveness of the MMR vaccine?
Yeah, so MMR vaccine is the measles, mumps, and rubella vaccine. We recommend it at age 1 and repeated for a second dose at ages 4 through 6. That's our normal dosing. It's extremely safe, extremely effective. We've been using it for well over 70 years in this country, millions and millions and millions of doses given. It is much more safe to get the vaccine than it is to get measles.
Now, there's a lot of talk, obviously, about vaccinations, and people are hesitant, and it's good to question things and, check in with things. But can you tell us about how vaccinations work to protect the community? Some people may not understand how it all works for community immunity.
Yeah, so as I mentioned, it's all about getting good information. So if you get vaccinated, you're prevented. 97% chance that you'll get it. But what's really important is it also protects the people who are at highest risk. Our young children who can't get vaccinated, people whose immune systems are down, and pregnant women. If we're all vaccinated, measles can't spread in our community. We can not only protect ourselves, but everyone else around us.
Dr. Fish, this is obviously a hot topic right now, so we appreciate you breaking it down for us in a very, logical way that we can all kind of understand a little bit better.
My pleasure. Thank you,
Lauren.
Thank you.